All right, joining us now, Representative Steve Cohen, Democrat of Tennessee, who voted against Trumpcare. He himself has a pre-existing condition as a polio survivor. Thanks so much for joining me. You saw how some... Absolutely. So you saw how some senators reacted to the health care vote this week. What was your reaction?
Well, I thought it was one of the most mean and cruel, harmful things that Congress has ever done. They repealed a bill that gave a lot of people health care. We'll take 24 million people off of health care. We'll give $1 billion in tax breaks to the richest people in the country, and we'll take nearly $1 billion out of Medicaid that gives health care to the people who are the poorest among us. This was just disgusting. It's not what America should be doing in 2017. It's not what America should have been doing in 1817 when we had slavery and women couldn't vote. But this was kind of going back towards that era. Giving to the rich, taking from the poor, not giving health care. The traditions of, in my mind, of Lyndon Johnson and Hubert Humphrey and even Richard Nixon, who was for national health care, are still good values. And we ought to finally get in tune with the rest of the world. We're the last industrialized country in the world without health care. And if it weren't for the plan that we passed in 2010, the Care Act, Patient Protection Act, the Republicans wouldn't be taking it up now. They know it's popular. They know they have to do something. They've not been as a team for national health care, even though this plan that we passed, the Affordable Care Act, was Mitt Romney's plan in Massachusetts, drawn up by the Heritage Group. It's a conservative plan that takes Democratic values of giving people health care and Republican ways of doing it by subsidizing insurance companies and keeping the private sector in. Personally, I'd like to have a single option, Medicare for all. That would take care of it.
But you have senators who are saying they're going to rework the plan once it hits them.
They have to rework the plan.
So what do you want from that? What do you want to see?
Well, what I'd like to see them do is go back to the Affordable Care Act and make it to where it is more affordable. And you can do that. There are corridors, high-risk corridors, that the Republicans didn't fund that can see that insurance companies that have great losses because the areas have such high health problems that they are given more federal money and subsidized to where it makes their entry into those markets financially reasonable. There are ways to make the Affordable Care Act more affordable and more workable. The basic mechanics are good, and the Republicans know that. That's why they've kept people being allowed to keep their kids on their insurance up to their 26, something they never thought about. That's why they talk about pre-existing conditions, but their plan will mean people with pre-existing conditions, such as me, if I was in that same situation, and I am in that situation, where they could say anything that's polio-related they wouldn't deal with. And in the South particularly, where states have really hurt poor people a lot over the years, and not cared about the least of these, you're going to see states do waivers that put people who insurance lapses at all, or people who have pre-existing conditions, and put them in high-risk pools that will not be funded enough. This $8 billion was a tiny fig leaf, not even a big fig leaf, just a tiny fig leaf. Couldn't make it on Instagram. They would take it off. It's just wrong.
I want to take a listen to Tom Price, Secretary of Health and Human Services, and his reaction to all of this, and then we'll talk.
Under Obamacare, the older folks and sicker folks could pay 3 times more than the younger folks, whereas under this plan, they might pay 5 times more. That's going in the wrong direction.
Well, it's pricing for what individuals' health status is, and that's important to appreciate. Somebody's going to pay for health coverage for the American people.
So someone's got to pay, but what if that someone doesn't have the money? What about the elderly folks?
Exactly. And the people, not even elderly, people 50 years of age and older will pay that 5 times as much as others, and it'll go up, definitely go up. It's a big hit for people 50 and over. I give the Republicans credit. They're looking at the people who mostly vote, people over 50, that's a high voting group, and they're looking at people who are middle income and are having trouble with this. Is going to really affect their ability to make insurance payments, which is their base, and they're saying the heck with you. We wanted to get this passed because the president told us he wanted it passed. Paul Ryan had to get it passed. They didn't care about the substance. They don't know, most of them don't know the substance. There wasn't a CBO score, which is anathema to good legislation. Ryan had claimed we're going to go by regular order. The amendment was not debated. There were no amendments allowed to the bill. There were only 40 minutes of debate allowed. They just said we take it up where it fell off a month ago. There should have been debate on it, and fulsome debate. There wasn't, and they don't know what's in it.
Yeah.
But they're going to be responsible for it in 2018. They voted to take people with pre-existing conditions and possibly cause them a death sentence.
And I just want to clarify what you said, that they decided to vote on this health care bill before the Congressional Budget Office came out with their report on it, whereas last time March, we saw the Congressional Budget Office report before anything hit the floor, and in that report it said 24 million people would lose their health care. Many experts saying this would prove to be the same. Representative Steve Cohen, thank you.